Have you heard? Can pheromones ease surgical stress? Think the value of pheromones is underappreciated? Novel research out of Barcelona, Spain has opened the door for potential uses of a synthetic dog pheromone for reducing the stress response in dogs undergoing surgery. A commercially available synthetic hormone is marketed for treating stress in dogs, namely to produce a calming effect in dogs encountering stressful situations such as kenneling, separation anxiety, and fear. This pheromone originates from intermammary sebaceous secretions of lactating bitches, but the precise mechanism of action is not known. These researchers in Spain aim to evaluate the effect of exposure to this pheromone on the perioperative stress response and evaluated a variety of indicators representing the neuroendocrine, immune, and acute phase stress responses. They assessed alterations in behavior, specifically decreases in alertness and visual exploration. They also measured other indicators of stress, inflammation, and pain, including salivary cortisol concentration, white blood cell count, and serum glucose and prolactin concentrations. 46 young, healthy dogs having spent at least 20 days in a shelter and scheduled for routine spay or castration were included in the study. Dogs showing overt signs of aggression or classic displays of pacing, circling, or tail chasing were excluded. With an even distribution of age, weight, and sex, they were randomly divided into two groups, one exposed to the pheromone solution before and after surgery, and the other exposed to the ethanol carrier solution alone. Each dog's behavior was videotaped for 30 minutes, and blood and saliva samples were taken on the morning of the scheduled surgery. This was repeated in specially prepared intensive care unit cages that were either sprayed with pheromone following the manufacturer's recommendations or with the placebo spray. One surgeon performed the procedures, and the same anesthetic protocol was used in each case. After the surgery, the dogs were again transferred to prepared cages, and their behavior was reevaluated after they were able to stand. At this stage, blood and saliva were again sampled, and the dogs were assessed for their level of pain using a dynamic interaction test. The evaluations and sampling were repeated back in the dog's usual environment, and again at 1, 2, and 8 days after surgery. All of the evaluations were videotaped and reviewed by a single investigator. The treated dogs did show some beneficial effects, displaying more alertness and visual exploration behaviors after surgery and having a significantly smaller decrease in postoperative prolactin than those in the untreated group. Prolactin has been shown in previous research to affect the neuroendocrine stress response and was notably influenced by pheromone exposure in the study. The findings of the study suggest that it is possible to improve the overall experience and well-being of perioperative patients with the use of this synthetic pheromone product. The researchers involved in the study suggest additional research to determine the mechanism of action and explore various clinical applications.